Hey everyone, I'm Dr. Wokucha Peter Gifts, also known as Dr. P or the Ratel Doctor. I want to use this opportunity, being 8th of April 2026, to congratulate our Ratel President and the group leader, in person of Mr. Martins Vincent Ose, on his special day today. Congratulations, sir. More grace and health to you. And also thank you for giving us the opportunity for using this platform to contribute our quota in aspect of health, improving the Nigerian health and also the world health at large. I'm speaking on behalf of the Retail Health Services, and I'll be talking about a topic termed Universal Health and Prevention. On this, I'll be talking about specifics on how to go about health, and this comes handy as we approach the World Health Malaria Day. Presently, the World Health Organization defines health as not just the absence of disease-causing issues, and also the physical well-being, psychological and social well-being of an individual. So we should understand this information once more. It has to do with the absence of disease, the physical well-being, psychological well-being, and social well-being. We'll get to them each one equally. Everyone everywhere should have access to universal health care. But the truth about it is that most diseases affecting us today are preventable. What is the universal health care? Universal health is when you fall sick, you have access to a hospital. You go to the hospital, you do not have financial limitation to your health condition, and you also receive quality health care. And now we come into prevention. Okay, so at this moment, beyond hospital, we understand that prevention starts at home and at the community level. And what this brings us about, there are 3 layers of preventive health. The primary preventive health is when you eat healthily, you wash your hands and use malaria-treated mosquito nets to prevent malaria. Drink clean water to avoid diseases. The secondary layer is eating healthy and also carrying out screening tests, which may include checking your blood pressure, your sugar level, screening for hepatitis, HIV, and syphilis, and so on and so forth. And the tertiary aspect, which involves treating diseases early to prevent complications, like a person is diagnosed of any health condition, it is imminent for the person to start medications and treatment as soon as possible. And that brings us to the aspect that preventing disease is far cheaper. At this aspect of preventive health care, the strongest tools remains community health care management. And in community health care management, we talk about prevention of specific environmental factors that may lead us to conditions that may breed microorganisms that may cause infection. For example, clearing of stagnated water and bushes will reduce the malaria-borne diseases. Also, making a clean water and making sure that water led to the house are not contaminated by sewage system. Cleaning off of drainage would prevent diarrhea and other forms of diseases. Now, just remember that your environment determines your health. The final focus is on malaria. Malaria is a disease that has a high death toll in Nigeria and in sub-Saharan Africa. The leading cause of death and loss of pregnancy in females. Now, how do we go about malaria? Malaria is very simple. It comes in symptoms of headache, fever, vomiting, and weakness, but these are not limited. However, if a diagnosis of malaria is made, it is imminent for the person to take laboratory tests, and those laboratory tests are very rapid. A blood sample will be taken, and under it, reactions will take place. And a more complex way is to visualize the malaria parasite in the slide. With that, anti-malaria drugs that are very, very effective are there, and we would advise you to adhere to the medications and complete them to avoid resistance of such malaria in your system. Thank you, and we'll continue.
As we've just heard from the Ratel doctor, health is not only doctors, professionals, it's for every one of us. Parents, teachers, youth, adults, communities, every one of us. We must all work together to keep our environment clean, keep our environment safe, and protect our health. Today, we're asking you to make a decision to keep yourself safe, stay healthy, keep your environment clean, and seek early intervention for all your medical conditions. If symptoms appear, go to the nearest hospital, because a healthy community is a strong community. And together with RHS, we can build a stronger and a healthier community as Nigerians.